Just a nurse. That's what Dr. Marcus Mercer thought as he watched her work. 6 months at Seattle General in Raleigh, and already he'd made up his mind about Ashley Cooper. She moved through the trauma bay like she'd done this 1,000 times before. The way her hands found exactly what she needed without looking. The way she anticipated what came next. The efficiency of someone who'd rehearsed this in her sleep. But he didn't see what mattered. He didn't see the surgical precision hiding inside competence. He didn't see the scars on her knuckles from drills he couldn't imagine. He didn't know that Captain Ashley Cooper had spent 17 years doing something that would make most doctors weep, and she'd done it in places where the next helicopter might not arrive in time. The hospital hummed around her like a living thing. Fluorescent lights buzzed overhead, that constant electric whine that made your teeth ache if you listened too long. Antiseptic burned her nostrils, sharp and chemical, the smell that meant sterile and safe and controlled. Everything at Seattle General was designed to be controlled. Ashley had learned long ago that control was an illusion. Still, she walked these corridors in her scrubs, blue fabric one size too big, hiding the muscle beneath, and she tried to fit inside the boundaries they'd drawn for a person with her credentials. Just a nurse. Title and nothing more. Her credentials said trauma nurse, 6 months employed, excellent references from people who technically existed. The truth lived somewhere else, in a file at the Pentagon, classified at a level she couldn't discuss at dinner. She arrived at 6:13 a.m. on a Tuesday in November, early enough that the night shift was still drowsy and the day shift hadn't fully woken. The parking lot had been half empty, her black 2019 Honda Civic parked in the back corner where she could see both exits, old habits made new again under orders. She'd changed in the locker room, exchanging her coffee-stained tactical jacket for the identity of a nurse. The faded unit patch from her jacket lining came out first, tucked safely beneath her locker. It was small, worn cloth with Hindu Kush embroidered beneath the Ranger tab, and she'd learned to move it quickly, almost without thinking. Out of sight. Out of context. The patch had traveled with her through 3 continents and into this fluorescent box in North Carolina. She pressed it flat against the metal bottom of her locker and covered it with a rolled scrub cap. The limp was intentional. A permanent favor from a burn incident at FOB Shank 6 years ago, the kind of injury that made perfect sense on a civilian trauma nurse's resume. Back injury, physical therapy, minor mobility adjustment. No one questioned small flaws. Perfect people raised questions. People with just enough damage to be sympathetic raised none. She favored her left leg as she walked, never dramatically, just a half-millimeter delay in weight transfer. Enough that anyone watching would categorize her as slightly limited, slightly less than, slightly less threatening. The trauma bay at Seattle General operated on organized chaos. 3 trauma bays arranged in a triangle, each one equipped with everything needed to save someone who'd already lost too much. Monitors with oxygen sensors and blood pressure cuffs hanging like technological spiders. Equipment towers with drawers labeled in bright letters, airway, chest decompression, bleeding control. Crash carts parked in corners, their red metal skins bright as blood. Ashley moved through the bays during her shift as if she designed them herself. Her fingers knew where the 14-gauge angiocath needles were stored. Her eyes could locate the endotracheal tubes without looking. Her body moved with the kind of muscle memory that didn't come from 6 months of experience. It came from doing this intense. In combat zones. Under fire. At 8:15 a.m., a trauma alert came through. Male, 42, motorcycle versus SUV, Glasgow coma scale of 14, alert and oriented but getting sleepy, and that was the problem. Head injury. Possible intracranial bleed. The ambulance was 7 minutes out. Ashley was already moving before the announcement finished crackling through the overhead speakers. She didn't run. Running looked panicked. She moved with purpose, each step economical, each hand positioning equipment without wasted motion. 2 liters of normal saline. Pressure bags. Rapid infusion pump. The stretcher was already positioned. She had 4s placed in both arms while the paramedics were still giving their report, before the patient arrived, already anticipating bleed and shock and the slow spiral that came when your brain started swelling inside its bone cage. The paramedic was young, nervous, talking too fast. No loss of consciousness on scene, but mental status changed in the ambulance. Started out knowing his name, time, place, now he's confused about where he is. Started slow, then. The paramedic made a hand gesture like a door closing. Ashley didn't interrupt. She was already scanning, already assessing. Pupils. Breathing pattern. Oxygen saturation at 98%. Heart rate regular at 88. She had the feeling, that strange knowing that came from experience, that this would get worse before it got better. Dr. Mercer appeared in the bay entrance at 8:22 a.m., moving with the casual authority of someone used to rooms reshaping themselves around his presence. He wore pressed slacks and a white coat that actually looked white, not yellowed like Ashley's, and his hair was dark and perfectly combed in a way that suggested he'd made personal grooming a priority. His eyes were sharp, though, that part she noticed. Sharp and assessing and hungry in a way that had nothing to do with medicine. Epidural hematoma, he asked, approaching the bedside. It wasn't really a question. He was thinking aloud, arranging the facts the way a chess player arranges pieces. Possible, Ashley said. CT's being ordered. Neuros on standby. She was placing a third line now, a central line for better access and clearer pressure readings. Her hands moved without hesitation, the kind of procedural confidence that came from doing this 200 times before, not twice. The needle went through skin, between ribs, into the subclavian vein, and she was already threading the guide wire while someone else might still be steadying their hands. Mercer watched. Not looking at the patient. Looking at her. At the way her fingers positioned the ultrasound probe. At the way she guided the needle with a kind of precision that suggested she'd done this in darkness. At the way she didn't fumble or second-guess or need reassurance. She was competent, and competence in a nurse was apparently a problem he'd already decided needed solving. How long have you been at Seattle General? His voice was smooth, the kind of smooth that got used to ask questions you already had answers for. 6 months, Doctor, Ashley said. She didn't look up from the line placement. The guide wire was advancing perfectly. The central line would be in before the patient's blood pressure dropped further, which meant easier access, which meant better control. Control. Everything came back to control, and she'd learned long ago that the best way to maintain it was to be competent enough that no one questioned you, but not so competent that you made anyone uncomfortable. Previous work experience. Trauma surgery at a military hospital for a while. She was being deliberately vague, intentionally under-detailed. People who came from military hospitals and didn't want to discuss it usually had reasons. Simple answers. No elaboration. She tied off the central line, taped it down with the kind of careful precision that made it look like she was just extremely thorough, not like she was ensuring a line would hold under field conditions. Mud, blood, chaos, this line would hold. Military. Mercer's eyebrow lifted. Which hospital? Walter Reed, mostly. True. She'd done training rotations there. True statements that covered a much larger truth underneath them, the way water covered a submarine, all visible surface, nothing below. I wanted a change of scenery. Raleigh seemed quiet. Mercer smiled. It was a smile without warmth, the kind of smile a tiger makes before it eats something smaller. Well, trauma nursing at a civilian hospital is quite different from military work. You'll need to be careful about expanding your scope. The protocols we follow here are very specific. We're not doing field medicine in a tent. Ashley met his eyes for the first time. Just for a moment. Just long enough to show she'd heard him, just long enough to show she wasn't afraid. Then she looked back at the monitor, at the numbers that told the story of this man's blood chemistry and oxygen levels and the electrical impulses keeping him alive. My scope is within nursing protocols, she said. Her voice was steady, measured, the voice of someone stating a simple fact. The protocols are clear. Of course they are. Mercer nodded, as if she'd just confirmed something he'd suspected. Just want to make sure there's no confusion. Nurses have a valuable role here, but we must remember the hierarchy. Doctors diagnose. Nurses execute. Understanding the difference is what separates good facilities from liability disasters. He left before she could respond, already on his phone, already moved on to the next patient, the next problem. But something had shifted in the room. Ashley felt it the way you feel air pressure change before a storm. The way you know, in your bones, that what just happened wasn't a conversation. It was a declaration. The patient CT results came back at 9:03 a.m. No epidural hematoma. No subdural collection. Just contusion, swelling, the kind of injury that you managed and monitored and hoped didn't get catastrophically worse. His mental status stabilized by 11:41 a.m. By noon, he was asking where he was and asking for water and making jokes about the nurse who kept checking his pupils. By 5:51 p.m., when Ashley's shift ended, he was stable enough that the immediate crisis had transformed into the slower crisis of recovery. She changed out of her scrubs at 5:22 p.m., watching herself in the small mirror in the locker room. A woman in her early 40s, brown hair pulled back, no makeup, lines around her eyes that came from squinting into sun that existed in a different country. A trauma nurse. That was what the mirror showed. That was what 6 months of careful performance had built. She retrieved the unit patch from her locker, pressed it against the inside of her jacket lining where it had lived before, where it would live again. A piece of fabric saying where she'd been. A piece of history that would get her killed if anyone with authority knew what it represented. But that wasn't the worst part. The worst part was knowing, already, that Dr. Marcus Mercer had decided she was a problem. She'd seen it in the way he looked at her hands, at the certainty in her movements. She'd seen it in the way he positioned himself as the authority she would need to defer to, the hierarchy he would need her to respect. And she'd seen it because she'd trained for 17 years to see exactly this kind of threat coming. Not from the direction you expected. Not from some enemy on a battlefield who announced themselves with gunfire. The threat came from inside the system. From the people who had power and felt it slipping away when someone else demonstrated competence they didn't understand. And Ashley Cooper, embedded deep in a civilian hospital under orders to watch for security breaches involving military patients, had just accidentally revealed that she might be far more dangerous than anyone had taught her to hide. Grand rounds happened at 7 in the morning, and the conference room smelled like burnt coffee and the particular anxiety that only comes when 17 people are forced to stand while one person sits. Dr. Mercer had requested Ashley's presence, not as a professional courtesy, but as a cautionary tale. She stood in the back row, hands folded, while he pulled up her patient assessment on the overhead screen. The fluorescent lights hummed their constant digital complaint above them. "Let's discuss nursing overreach," he began, his voice carrying the casual cruelty of someone who had never been told no. "Nurse Cooper here documented signs of potential post-op bleeding in our coronary bypass patient and adjusted monitoring parameters without consulting the surgical team. This is precisely the kind of dangerous independence that gets patients killed." He turned. Looked directly at her in the back row. His smile was a weapon. "Tell me, Nurse Cooper, when did Seattle General start granting medical degrees in the break room?" Scattered nervous laughter. The residents exchanged glances, the kind of glances that said they had been warned. The attending surgeons remained silent, which meant something far worse than mockery, they were allowing it. Ashley took one measured breath. She felt the tear escape before she could stop it. She wiped it away without breaking eye contact. Her voice came out steady as a surgical baseline. "My assessment prevented a bleed, doctor. The patient is stable." Mercer's smile widened. "You got lucky. Luck isn't medicine." He turned back to the slides, dismissing her from consideration as casually as erasing a whiteboard. The presentation continued. Ashley remained standing in the back, her composure like armor plating. Inside, her pulse was a metronome keeping time with something darker, not fear, but the particular calm that comes from having survived worse than public humiliation. That tear had been tactical. A single drop of human vulnerability that made her look breakable. She was not breakable. She had extracted herself from a Taliban compound in the Hindu Kush with a compound fracture of the femur and a 9mm round in her shoulder. She could survive a physician's contempt. The next morning, at the vending machine on the 3rd floor, the real damage happened. Ashley needed coffee. Not for the caffeine, but for the ritual of ordinary people doing ordinary things. The vending machine hummed like it was keeping secrets. She fed in $2 and pressed bead 4. The cup dropped with the mechanical clunk of a choice made irreversibly. 2 residents emerged from the hallway, Rodriguez and Kim, both third-year internists, both people she had mentored 6 months ago when she first arrived. She had stayed late with Rodriguez during a complex post-op complication, had shown him how to read the early signs of sepsis before the cultures came back. She had helped Kim intubate a pediatric airway on her 2nd attempt, had stood beside her and whispered, "You've got this. Trust your hands." Both of them stopped. The hallway suddenly had a weight to it, a thickness in the air like the moment before a storm breaks. Dr. Mercer appeared behind them, his white coat pristine as a flag of surrender. He moved with the confidence of a man who had never been seriously questioned. His voice was loud enough for the entire floor to hear. "I'm genuinely curious whether someone with her limited training should even be touching critical patients. Perhaps we should have her stick to bedpans and vitals. Keep her in her lane, so to speak." Ashley's coffee cup slipped from her hand. It hit the tile floor with a sound like a gunshot in the silence. The brown liquid spread across the white floor like an accusation. She bent to retrieve the cup, moving with deliberate calm. Rodriguez and Kim stood frozen. Neither moved to help. Neither made eye contact. That silence was the worst part, not that Mercer had spoken, but that they had chosen to let him. Ashley straightened, holding the empty cup. Mercer smiled as she came upright. The smile of a predator that has drawn blood and is waiting to see if the prey will fight back or break. "My training is adequate for the work I do here, Doctor." The words were quiet. Almost gentle. Which made them more devastating. There was no anger in them, no defensiveness, no crack in the voice. Just a statement of fact, delivered with the kind of certainty that comes from knowing exactly what you can do. Mercer's smile froze for exactly 1 second. Then he moved past her to the vending machine, dismissing her as completely as if she had evaporated. "Enjoy your break, Nurse Nightingale." The nickname was new. It was designed to sting, turning Florence into something pathetic, something less. Over the next 48 hours, it spread through the hospital like a virus. Mercer used it constantly, in front of staff, in front of patients' families, his voice dripping with condescension so thick you could operate in it. He called an all-hands meeting with the surgical nursing staff and spent 20 minutes discussing the dangers of nurses playing doctor, his eyes fixed on Ashley the entire time. He filed a formal observation request, citing quality assurance concerns. He wanted to shadow her cases. He wanted documentation of every decision, every moment she deviated from strict protocol. By day 3, every move she made was being watched. Every fall line, every vital assessment, every suggestion she made to a resident was being photographed with his phone, time-stamped, filed away into a growing digital archive of her supposed incompetence. The supply closet was where nurses went to fall apart. It was small, windowless, lined with boxes of gloves and saline bags and the medical infrastructure of keeping people alive. Ashley had not set foot in it until day 3 of Dr. Mercer's systematic dismantling of her professional reputation. Her hands were shaking when she closed the door. Not from fear. From restraint. From the effort of not walking directly to his office and showing him exactly what 20 years of military medical training looked like when it stopped pretending to be meek. She opened her locker. The unit patch was still there, tucked into the pocket of her civilian jacket, faded and worn, sewn into the lining decades ago by hands that had known how to stitch wounds shut in the dark. Hindu Kush embroidered beneath the Ranger tab. The symbol of a deployment that had never happened in any official record, a unit that didn't exist on any public database, a war that she had fought in 3 different uniforms for 3 different governments in the span of 4 years. She pressed her palm against the patch. Felt the slight raised texture of the embroidery. Closed her eyes. The intercom crackled to life. Trauma alert. Multiple GSW. ETA for minutes. Her hand stopped shaking instantly. Muscle memory took over. The supply closet, the fear, the humiliation, all of it vanished into background static. She was a nurse now. The Army Ranger medic, the CIA paramilitary, the shadow who had operated in places that didn't appear on maps, all of that was covered over by scrubs and a name tag and a job title that paid $38,000 a year. The ambulance sirens wailed through the parking lot like a premonition. Ashley moved toward the trauma bays. Her stride had changed. The shuffle of a meek nurse had transformed into something sharper, more efficient. The kind of movement that came from training that was never meant for civilian hospitals. Paramedics rushed through the automatic doors with a gurney, their voices rapid and practiced. Male, 30s, found collapsed downtown outside a warehouse. Initial assessment suggests assault with possible internal bleeding. No wallet on scene, no identification, unresponsive, BP 92 over 58 and dropping. She took the gurney. Moved beside it without asking permission. The patient was barely conscious, his breathing shallow, his skin the color of old paper. His clothes were torn, and beneath the rips she could see the faint outline of a tattoo on his upper arm, the crossed rifle and wreath of the Army Ranger Regiment. Her hands moved on their own. She searched his pockets while calling out vitals to the intake nurse, her voice clinical and precise. No wallet. No driver's license. Nothing. Then she checked his jacket lining, felt for the small interior pockets where soldiers always kept their most important documents. Her fingers found it, a thin pocket sewn inside the lining. She withdrew a military ID card. Staff Sergeant Michael Torres. 75th Ranger Regiment. Combat medic. Her breath caught for exactly 1/4 of a second. Enough time to feel it. Not enough time for anyone to see. She felt something else in that pocket, something fabric. She pulled out a faded unit patch, no bigger than a postage stamp, the embroidery worn but unmistakable. Hindu Kush. Ranger tab. The same patch that was hidden in her own locker. The same deployment. The same unit. The same war that had never been declared. She tucked it back into the jacket lining. Kept the ID card. The Ranger needed an fall line. Ashley moved to the gurney, grabbed the standard 18-gauge angiocath needle and tourniquet. But as she positioned the needle, her hands moved with a technique that no civilian nursing program teaches. She found the vein by landmark and angle rather than standard surface visualization, a field medic's method, developed for finding veins when the light is bad and the patient is in shock and you have 90 seconds to get access before the body starts to shut down. The Ranger's eyes flickered open. He stared at her hands. At the precise angle of her needle. At the way she secured the line with the kind of efficiency that only comes from practice in conditions where efficiency meant the difference between a patient who lived and a patient who became cargo. His eyes focused. His pupils sharpened. "Your medical corps," he whispered. His voice was barely audible, but his words carried the weight of recognition. "I've seen that stick before." Downrange. Ashley's face remained neutral. Her pulse hammered like helicopter rotors in her chest. She did not look at him. She did not acknowledge the words. She simply continued working, her hand steady as a surgical laser. "Rest, Sergeant. You're safe." His hand gripped her wrist. A weak grip, but insistent. The grip of a soldier who had just recognized another soldier. She did not pull away. She let it happen for exactly 2 seconds. Then she gently extracted her wrist and moved to hang the fall line. His eyes closed. His hand fell away. Dr. Mercer entered the trauma bay, his presence announced by the particular displacement of air that powerful people create when they move through rooms. His eyes went to Ashley, then to the Ranger, then back to Ashley. "Problem, Nurse Nightingale. Patient is stable, Doctor. Vitals holding." She continued working as if he was not there. As if his opinion mattered less than the beeping of the monitors and the steady drip of saline through the 4 lines she had placed with a technique that had been developed in the shadow of mountains she had never been to. Mercer reviewed the chart. His eyes narrowed as he read her documentation. She had written everything: the assessment, the field technique, the patient's whispered words. Not because she was trying to be detailed, but because trauma assessments required detail. What she had not written was what those details meant. What they revealed. She watched him make a connection. Just a flicker. Just enough for her to see the moment when something shifted in his expression. He pulled out his phone. Took a photograph of her for technique as she stood beside the gurney. The shutter sound of the camera was so quiet nobody else heard it. Ashley heard it. Heard it and understood it for what it was: the moment when documentation became evidence. The moment when Dr. Mercer began building his case not just against a competent nurse, but against someone who might be something else entirely. The ambulance sirens wailed like something wounded, cutting through the morning traffic on Capitol Boulevard. Ashley heard them first, that ascending pitch that meant critical, meant now, meant every second was data. She was already moving toward the trauma bay before the radio crackled with the call-in. 34-year-old male, unconscious, penetrating trauma to the abdomen, no ID on scene, civilian clothes over what looked like military-grade trauma pants. ETA 2 minutes. The doors burst open and the world compressed into motion. 2 paramedics wheeling a stretcher, a man's body rigid with shock, his face the color of old concrete. Ashley saw the torn civilian jacket first, a deliberate cover she recognized immediately. Beneath it, visible only if you knew what to look for, was the distinctive tan of an army combat uniform. Ranger scroll patch on the shoulder, partially hidden. Not random violence. Targeted. This was the 4th one. She moved alongside the stretcher, her hands already calculating, assessing. What's his baseline vitals? Her voice was low, professional, the voice of a nurse with 6 months of experience in a busy trauma department. Not the voice she used in encrypted calls to a number that didn't technically exist. Found down at the Harbor District, about 0630, the paramedic said, rattling off numbers like a prayer. GCS of 8, dropped to 6 en route. We've got 2 large bore access, running fluids wide open. Pressure's 70/40 and it's not coming up. 70/40. Hemorrhagic shock. He was bleeding internally, losing volume by the second, and his body was already folding in on itself to keep the organs alive. The clock had maybe 20 minutes before irreversible damage. Maybe less. They wheeled him into Trauma Bay 3, and the room filled with bodies. The trauma surgeon, not Mercer, thank God, this was Dr. Holloway, began barking orders. Ultrasound to assess for free fluid. Complete blood panel. Type and cross for O negative. Get him on the monitor. Ashley moved to the head of the bed as they transferred him from the stretcher to the hospital gurney, and that's when she saw it, a military ID tucked inside the jacket pocket, partially visible, leather-worn soft from years of carrying. Sergeant Marcus Torres. 75th Ranger Regiment. 3rd Battalion. The 4th one in 8 weeks. All Rangers. All with penetrating trauma that looked random but wasn't. All arriving at Seattle General within a 200-mile radius. All matching the pattern she'd been sent to investigate. I need an 4, Holloway said. Trauma protocol, let's move. Ashley was already there, equipment cart already in motion, hands reaching for the supplies. 18-gauge catheter, normal saline wide open, pressure bag waiting. Routine. Textbook. Except the moment she looked at Torres's left arm, muscle memory took over. Not civilian trauma nurse muscle memory. Combat medic muscle memory. His arm was edematous, swollen from fluid loss and shock, the veins collapsed. Standard for would take 30 seconds she didn't have, and the patient was too unstable to wait for the challenge of a difficult stick. She reached instead for the IO, intraosseous needle. The field technique. The one that bypassed veins entirely and went directly through bone into the marrow space where absorption was instant, where every second mattered more than comfort. She found the tibial plateau, felt for the landmarks, 2 finger widths below the knee, medial surface. She swabbed with antiseptic that smelled like copper and iodine. The needle was 14 gauge, long enough to penetrate the cortex. She angled it at 45 degrees and felt the subtle give of bone, then resistance. Then the sudden release as the needle punched through into the marrow space. The saline ran in like water through a funnel. Good access, Dr. Holloway said, not looking up. He didn't recognize what she'd done. Most civilian nurses couldn't do IO work. Most didn't need to. But Ashley had spent for years running combat casualty care protocols in a valley where helicopters didn't come, where improvisation wasn't an option, it was survival. She looked down as she secured the needle to Torres's leg with tape, and his eyes were open. Not awake. Open. Conscious somewhere deep underneath the shock and blood loss and trauma, reaching for the surface like a diver searching for air. His pupils tracked her, focused, and his lips moved. Once. Twice. His voice came out like wind through a dry canyon, barely there, barely real. Your medical corps, he whispered. I've seen that stick before. The room didn't stop. Dr. Holloway was still calling orders. The nurses were still moving. The monitor was still beeping its steady rhythm. But Ashley felt the architecture of her cover shift, just slightly, like a building resettling on its foundation. She kept her hand steady. Kept her face neutral, the expression of a nurse acknowledging a patient's comment, nothing more. I'm going to get you stable, Sergeant. She said his rank because he'd taught her to listen, because he was military and he'd recognized the way her voice changed on that word, the weight she gave it. Not a guess. A statement. You're going to be okay. His eyes held hers for 2 more seconds, and she saw recognition there. Real recognition. Not of a nurse. Of something else. Then his eyes slipped closed again, and the paramedic protocol took over. Blood bags hanging. Massive transfusion protocol activated. Holloway was already making calls about the operating room. Torres was being moved again, through the hospital like cargo, toward surgery, toward the part where Ashley couldn't follow. She stepped back from the stretcher and watched him disappear through the double doors. Her hands were clean. Her heart rate was exactly where it needed to be. Her face was precisely the right expression of professional concern. But her phone was already buzzing in her pocket. The next 3 days moved like weather, inevitable, inescapable, full of the pressure of things changing. Torres made it through surgery. Dr. Holloway's notes indicated miraculous hemodynamic stability given the degree of hemorrhagic shock, which was a way of saying the IO access had saved his life in those first critical minutes. The surgical repair was extensive, 2 units of small bowel resected, spleen removed, vascular repair to a branch of the celiac axis, but the kid was young, strong, the kind of resilient that only came from a body trained to survive impossible things. Ashley monitored his recovery protocol. 24-hour post-op vitals. Wound assessments. She was the one who noticed his left pupil was slightly larger than the right on day 2 morning rounds, caught the subtle sign of elevated intracranial pressure before it became an emergency. She ordered a CT, and it showed a small subdural hematoma, not immediately life-threatening but requiring observation. She wrote detailed notes in his chart. Every observation. Every measurement. Building a case through documentation that she knew this patient's physiology better than anyone else in the hospital. That was her job, after all. That was why she was here. On morning rounds day 3, Dr. Mercer arrived in Trauma Bay 3 without warning. He stood in the doorway for a moment, looking at the chart, looking at Torres, still sedated, still recovering, his abdomen wrapped in gauze and his left side carefully positioned to prevent any pressure on the surgical site. Mercer's expression was the kind of calm that preceded storms. The kind of calm that meant he'd been thinking about something. Planning something. "Nurse Cooper," he said. His voice was polite. Almost friendly. Which was exactly how Ashley knew she was about to lose access to her investigation. "I'm taking over Mr. Torres's care. His case is becoming quite complex. I think we need someone with a more comprehensive background." She didn't move. Didn't react. Just waited for the rest of it. The subdural hematitis, the vascular complications, the trajectory of his recovery, it's evolved beyond standard nursing parameters, Mercer continued. He was building it as he spoke, Ashley realized. Building the narrative. Creating the documentation trail that would make sense when he filed reports later. "I'll personally oversee his care from this point forward. Please ensure I'm CC'd on all vitals, all assessments." "Actually, no. You can step back from primary care entirely. Reassign to the cardiac ward. I'll bring him a more experienced RN." There it was. The strategic move. Not crude. Not a tantrum. Just the efficient removal of a complication from his sight line. "Doctor, I've been managing his baseline for 3 days," Ashley said. Her voice was level. The voice of a nurse advocating for patient continuity. "I can brief the new nurse, but—" "That's an order, not a discussion," Mercer said. And he wasn't looking at her anymore. He was already moving toward Torres, already pulling up the chart on the bedside computer, already rewriting the narrative. "You can finish your current notes and then transition to the cardiac ward." "Thank you." Ashley stood for exactly 3 seconds. Long enough for him to notice. Long enough for the moment to matter. Then she nodded once and walked out of the room, her jaw tight, her breathing controlled, her mind already counting the damage. He'd cut her off. He'd isolated her from the investigation. He'd done it clean enough that no one would question his reasoning, competent enough that he wasn't just being vindictive, he was being a doctor concerned about patient care. But that wasn't the worst part. She watched from the hallway as Mercer examined Torres. She saw him order another CT, a more expensive one than necessary. She saw him write orders for more frequent neuro checks than the patient's condition warranted. She saw him, quite deliberately, remove her name from the care team and replace it with another nurse, a Jennifer Santos, who was competent but new, who wouldn't have caught the pupil change in the first place. That afternoon, she received a printed message in her mailbox. 3 incident reports, all dated the same morning. All signed by Mercer. She read them in the staff bathroom, standing in a stall with the fluorescent lights humming their endless mechanical prayer. Report 1, unauthorized field medical technique during foreplacement, specifically intraosseous access at tibial plateau. Procedure performed without physician supervision or explicit authorization. Significant risk of infection and compartment syndrome. Nursing staff should be restricted to standard peripheral access protocols. Report 2, excessive time invested in single military patient. Pattern of boundary crossing behavior including non-indicated assessments and chart surveillance. Possible inappropriate relationship development or security concern. Recommend investigation. Report 3, documentation patterns inconsistent with standard nursing practice. Specifically, use of tactical assessment terminology in clinical notes, reference, hemorrhagic shock trajectory analysis, pattern recognition protocol, baseline vitals optimization. Suggests nursing staff may be operating outside scope of practice or potentially creating false impressions of expertise. He'd photographed her notes. He'd documented her language. He'd built a case not just against her competence but against her character, against her professionalism, against the very fabric of her existence in this hospital. And he'd copied HR. The final detail was a meeting request. Sent to her at 4:27 p.m. on day 3. Formal language. Respectful phrasing. Please attend a meeting with Human Resources and Hospital Administration to discuss professional development and scope of practice compliance. Date, tomorrow morning, 8 a.m., Conference Room C. Her phone buzzed as she was standing in that bathroom stall, still holding the incident reports. Not hospital communication. Encrypted message from her handler. A single line, status on Torres. Still operational. She stared at her phone for a moment. Then typed back, compromised. Cut off from patient access. Mercer has isolated investigation and filed formal complaints. HR meeting scheduled tomorrow morning. The response came in seconds. A thumbs up emoji. Then, continue assignment. This is the break we need. Ashley folded the incident reports back into thirds and slipped them into her pocket. She walked out of the bathroom. She finished her shift. She drove home in the rain, her hand steady on the steering wheel, her mind cataloguing the damage, her training telling her what came next. Mercer thought he was attacking a nurse who'd overstepped. He had no idea he was cornering a soldier. 3 days. 72 hours of watching Sergeant Torres recover in Bay 7, his vitals stabilizing, his color improving, and Ashley Cooper noting everything with the precision of someone cataloging evidence. The bruising patterns on his ribs didn't match the story he'd given the ER physician. Random mugging, he'd said, stumbled into the wrong crowd. Except the injuries formed a grid. Systematic. Targeted. Someone had wanted information from him, or wanted him dead, and the pattern matched 2 other military patients Ashley had treated in her first month here. The security breach she was embedded to investigate was crystallizing into something sharp and specific, and Torres was the third point on a triangle that suggested coordination, surveillance, and a leak from inside the hospital itself. She documented it all in coded language buried in routine nursing notes, filed reports that looked ordinary to any observer but sang in a frequency only command could hear. The mission was working. The mission was accelerating. And Dr. Mercer had just begun the process of destroying her ability to see it through. The code alarm shrieked at 6:22 a.m. while she sat in the HR waiting area, fingers folded, waiting for her employment to be formally terminated. The sound cut through the walls like a blade. Trauma Bay 7. Her bay. Her patient. She stood without thinking, muscle memory overriding procedure. The HR director reached for her wrist. Ms. Cooper, we're not finished here. Ashley's eyes didn't move from the door. Someone's dying. She was already moving. The trauma bay erupted in the organized chaos of a code in progress, monitors screaming, staff calling vitals, the mechanical hiss of the ventilator. Torres lay on the bed with his chest rising on the right side only, his left side still and sunken, his trachea deviated like a compass needle pointing wrong. Tension pneumothorax. The lung had collapsed under pressure, compressing his heart, crushing his ability to oxygenate. He had minutes. Maybe less. Dr. Mercer stood at the head of the bed barking orders with the confidence of a man who believed his voice alone could alter physics. Get me a chest tube tray. Where's respiratory? Call anesthesia, we need an emergent intubation. A resident fumbled with the equipment cart. A nurse stood frozen, searching for supplies that hadn't been staged. Mercer's commands were correct, but his timing was catastrophic. The tube wouldn't arrive from respiratory in under 8 minutes. Torres's oxygen saturation was already dropping. 91, 87. 84. The monitor's beeping accelerated like a countdown to emptiness. Ashley stepped past the threshold. The room smelled of antiseptic and fear. That particular acid sweat that fear produces when someone knows they're watching a patient slip away. Mercer glanced up, saw her, his face hardening. Ms. Cooper, you are not authorized to be in this bay. Leave immediately. She didn't acknowledge him. She moved to the crash cart with the fluidity of someone who'd performed this action under fire, intense without electricity, with shrapnel still falling outside. Her hands found the needle before her conscious mind had finished the assessment, 14-gauge angiocath needle, the metal cool and precise against her palm. The room's air pressure seemed to change around her, the way air changes when apex predators enter a space. She identified the anatomical landmarks by feel and sight simultaneously, second intercostal space, midclavicular line, the exact point where a needle becomes the difference between life and death. Doctor, he needs immediate decompression. Her voice dropped an octave. Not a request. Not a question. A statement of fact. Mercer's voice cracked like ice. Step back, nurse. That's a physician-only procedure. Step back now. She didn't step back. She inserted the needle with the same steady hand that had threaded catheters while explosions rocked the aid station in Cunha province. The sensation of the needle sliding through skin and fascia was muscle memory made real. And then the sound, the hiss of air escaping under pressure, a whoosh of release, the pneumothorax venting into the room like a held breath finally exhaled. The monitors shifted. Oxygen saturation climbed, 86. 89, 92. 95, Torres's chest began to rise symmetrically. His heart rhythm steadied. His eyes flickered open, confused but present. The code team burst through the doors 3 seconds later, respiratory therapist in the lead, portable chest tube kit in their hands. The clinical moment had already passed. The crisis had been interrupted mid-collapse. Torres was conscious. Stable. Breathing. The transition from catastrophe to recovery had taken 45 seconds. Dr. Mercer's face went through a sequence of colors, white, then red, then a shade of purple that suggested his blood pressure had climbed into dangerous territory. His voice, when it emerged, was quiet and controlled in a way that was infinitely more terrifying than shouting. "You just performed an invasive procedure without physician authorization." He turned to the resident and the respiratory therapist, both standing frozen with their equipment. "Everyone here is my witness. Ms. Cooper violated Hospital Protocol 7.3.2 regarding scope of practice. I'm documenting this incident." He pulled out his phone, his hands moving with mechanical precision. By afternoon, Ashley would learn that he'd already filed incident reports from memory for 3 prior occasions, interventions she'd made, decisions she'd executed, all of them technically outside strict nursing parameters, all of them documented retroactively and timestamped and copied to hospital administration with cover memos that read like prosecutor briefs. Security arrived within minutes. The officer, a young man with a confused expression, explained that Dr. Mercer had requested her immediate removal from the unit. "Nothing personal," he said. "Doctor's orders." Ashley walked out of Trauma Bay 7 with her badge still clipped to her scrubs, her hand steady, her expression neutral. One measured breath. That was all it took to keep the trembling from being visible, and it wasn't fear that tried to shake her. It was rage. Pure, controlled, military-grade fury at a man who'd weaponized procedure against someone trying to save lives. The HR director was waiting when she returned to the conference room, now accompanied by a man in a hospital tie who carried the weight of liability like a second spine. The incident reports were spread across the table like a winning hand in poker. "Ms. Cooper, we have 3 documented violations in 6 months. Incident from April 12, unauthorized medication administration. June 3, independent procedural decision without physician consultation. And today, an invasive emergency procedure performed without authorization." The director's voice was empathetic but final, the tone of someone executing a necessary task. "The hospital's legal counsel advises immediate termination to limit liability exposure. We're terminating your employment effective immediately. You'll need to clear your locker today and surrender your access badge." Ashley sat with the posture of someone at attention, though she occupied only a chair. "I saved his life," she said. "You broke protocol," the director replied. "Clear your locker today." The hospital laundry room was empty at 4 p.m., just fluorescent panels humming their mechanical hymn and industrial washers breathing steam into the recycled air. Ashley stood folding her scrubs with the precision of someone preparing equipment for inspection, each crease aligned, each fold military perfect, each movement economical and controlled. The fabric was still warm from the dryer. She'd been here 6 months. She had saved 17 lives that she could count, maybe more if she included the near misses, the interventions that prevented complications, the patients who walked out because someone had noticed what was wrong before it became catastrophic. She'd been embedded in this hospital to identify a security breach affecting military personnel, and she'd found it, a pattern of assaults targeting servicemen admitted for routine care, targeted attacks suggesting surveillance and coordination from inside the institution. 3 data points. 3 soldiers. And the investigation had barely begun. The termination meant she'd lost her access. The mission was still active, but the mission was now compromised. Command would have to pull her, reassign someone else, start over. And Mercer, Dr. Mercer would walk free into his next career move, his next hospital, his next opportunity to destroy someone who threatened his authority with competence. She folded the last scrub shirt and placed it in her bag. A single tear escaped, and she wiped it without breaking, without pausing, without giving the gesture any weight. Then she turned off the lights and walked toward the exit, wondering if saving one man's life had just cost dozens of others their chance at protection. The next morning, Dr. Mercer sat in the hospital administrator's conference room on the 4th floor, his incident reports arranged like evidence at trial. He was explaining his documentation methodology, how he'd been forced to protect the institution from a nurse operating beyond her qualifications, when the door burst open and a 17-year-old boy in a civilian jacket stood panting, his backpack spilling open to reveal the edges of a dress uniform and the corner of a shadow box containing military medals. "Mom, they need to see these, you can't let them do this." Mercer's mouth opened. He had no idea the explosion was beginning. By the end of the week, Ashley stood in the hospital laundry at 11:24 p.m., folding her scrubs for the final time. The fabric was still warm from the dryer, carrying the smell of industrial detergent and something else, the ghost of antiseptic that never quite washed out. Each crease was perfect. Muscle memory. 23 years of discipline doesn't vanish because a hospital administrator signs a termination letter. The scrubs were navy blue, size small, her name still embroidered on the chest pocket in white thread. She traced the lettering with one finger, then placed the folded stack on the laundry cart. Behind her, the fluorescent lights hummed their mechanical song. No one else was here. Security had escorted her through the ER at shift change, when the staff would see. Mercer had arranged that detail personally. Maximum humiliation. Minimum witnesses. She'd saved a man's life. She'd followed every protocol, used every skill, done exactly what the ranger needed when his lung was collapsing. And for that, she was being fired. The reasoning was documented in triplicate: unauthorized invasive procedure, scope of practice violation, failure to await physician authorization. Protocol 7.3.2. Every word a knife. But the real cost wasn't the termination. It was the mission. For military personnel attack near Seattle General in 6 months. For cases. She'd been here to find the pattern, to identify the threat, to protect soldiers who came through these doors bleeding and vulnerable. Sergeant Torres was supposed to be the key, his case would unlock the larger operation. Intelligence was close. JSOC was waiting for her final report. Instead, she was folding scrubs in a laundry room while Mercer's investigation into her background triggered every security protocol at the Pentagon. Her embedded identity was compromised. Her cover was blown. And the pattern she'd been assembling, piece by piece, was about to explode in directions she couldn't control. She'd won the battle. She might lose the war. The note came the next morning. Not a message. A physical envelope, slipped under her apartment door by someone who knew which building, which floor, which unit. Inside, a hospital discharge summary, Torres's vital signs from his final night, and something else. Something small and fabric-wrapped. Ashley unfolded the cloth with hands that didn't shake because they'd held far worse than this. A patch. Faded olive drab, the edges worn soft from decades in a pocket or sewn inside a jacket. A ranger tab. Below it, embroidered in gold thread so ancient it had turned the color of old blood, Hindu Kush. The same deployment. The same mountains where her team had operated under different flags, where she'd performed field surgery under fire, where she'd learned that the difference between a live soldier and a dead one often came down to 60 seconds and steady hands. Torres had pressed this into her palm during her final visit to his room, when the monitors showed normal sinus rhythm and his eyes were finally clear. His voice had been barely a whisper, "Your medical corps. I've seen that stick before. You saved my life the way only someone who's worn the uniform knows how." She'd tried to give it back. He'd closed her hand around it. "This comes home. You come home. That's how it works." Now it was hers. Evidence of a soldier she'd saved. and proof that somewhere, someone at the Pentagon was connecting the dots between a discharged Army Ranger and a trauma nurse with knowledge of field medicine that no civilian should possess. The phone rang at 6:33 a.m. Unknown number. She answered. The voice was clipped, military precision in every syllable. "Captain Cooper, this is Commander Sarah Mitchell, Naval Investigative Service. We need to talk about your assignment at Seattle General. We also need to talk about Dr. Marcus Mercer." The audit began at Seattle General within 18 hours. Not the kind of casual compliance review the hospital conducted annually. This was a federal investigation. The Pentagon had uploaded its request to the hospital's legal department, a request that was functionally a command. Review all surgical procedures performed by Dr. Mercer over the past 5 years. Cross-reference with nursing documentation. Identify discrepancies. The compliance officer, a woman named Diane Rothstein who'd seen her share of institutional corruption, assigned 3 staff members to work through the records. By hour 4, she called the hospital CEO. By hour 6, the CEO called Mercer's attorney. The pattern was impossible to hide once someone actually looked. Patient 47B, a Marine captain, presented to post-operative recovery with hemorrhagic shock 40 minutes after Mercer's procedure. Nursing notes documented rapid blood loss, emergency return to OR, 7 units of packed RBC, life-threatening bleeding from a vascular injury. Mercer's surgical report, 0 complications noted. Normal closure. Estimated blood loss, 75 milliliters. Patient 62A, a Navy corpsman, developed sepsis on post-op day 3. Fever, elevated lactate, positive blood cultures. Nursing documentation clear and specific, line placement at 14:22, culture results at 18:07, antibiotic started at 18:31. Mercer's notes, no signs of infection. Discharged on schedule. Patient 71C, an Army Ranger, extubated successfully post-procedure and then reintubated at 2:15 due to respiratory distress related to aspiration. Nursing notes recorded the event in detail, vitals, timeline, intervention. Mercer's report, routine post-op recovery. No complications. The investigator, a Navy medical officer named Captain James Hollis, sat across from Mercer in a small conference room with a recorder running. On the table between them, 5 patient files, each one documented in Mercer's handwriting and each one a lie. "Doctor, I'm reading your report on this patient. You documented 0 complications. But nursing staff recorded post-operative hemorrhage requiring emergency intervention. Can you explain the discrepancy?" Mercer's face had gone the color of wet ash. Nursing staff often exaggerates. 3 of these patients were active duty personnel. Their medical records are federal property. Falsifying them is a federal crime. The words came out like a judge's sentence. Not interrogative. Not debatable. Mercer's attorney, present via video conference, immediately intervened. "My client has no further comment without counsel present." But the damage was already quantified. 5 years of surgical reports. 1,483 procedures. A pattern of minimized complications, altered timelines, documented discrepancies that all pointed in one direction. Blame shifted to nurses who couldn't defend themselves in surgical meetings. Residents who were subordinates and knew better than to contradict a senior physician. Patients who complained were discredited through the same bureaucratic weapons Mercer had wielded against Ashley: incident reports, policy violations, documentation trails that made them look unreliable or drug-seeking or psychiatrically compromised. The state medical board received a complaint packet 3 inches thick. Mercer's attorney advised immediate resignation. No hearing. No public board review. Quiet departure with a minimal penalty if settlement terms were met. The hospital CEO offered the same calculus: resign today or face termination and litigation. Mercer, his hands finally shaking, finally revealing the trembling that betrayed men who understood they'd lost everything, signed the resignation letter at 4:17 p.m. on a Tuesday. By 5:53 p.m., his hospital privileges were suspended. By 6:27 p.m., the state medical board initiated probationary status pending investigation. By 7:27 p.m., security escorted him from the building, the same way they'd escorted Ashley. The same cart. The same hallway. The same message, "You no longer work here." As he passed the trauma bay where Torres had been saved, Ashley was standing there reviewing a chart. She didn't look up. She didn't acknowledge him. That composure, that absolute refusal to react, to triumph, to even acknowledge his existence, was what broke him most completely. Because she'd known. She'd known exactly what would happen when that investigation touched him. She'd known that the weapon he'd forged against her was capable of cutting both directions. And she'd walked directly into it anyway, unflinching, certain of the outcome, willing to sacrifice her own mission to expose what he really was. 6 months later, Ashley opened the door to the Veteran Services Program office at Seattle General. Her office. Her title, Director, Veteran Services Integration. The position had been created specifically, a response to the assault investigation that had exposed the targeting pattern, 3 arrests, 1 international incident that remained classified, and the recognition that this hospital served military personnel who carried invisible wounds alongside their visible ones. The walls were cream-colored, windows overlooking the trauma bay. On her desk, a photograph of her son in his dress uniform, rock commission ceremony, the pride in his eyes unmistakable. And beside it, framed, the faded Hindu Kush patch Torres had pressed into her hand. The gold thread caught the morning light. Sergeant Torres visited the office every Tuesday at 2:44 p.m. for PTSD counseling through the program she'd designed. He was walking unassisted now, the chest tube scars faded to white lines, the psychological wound still healing through sessions with a combat psychiatrist on staff. He'd been the 4th soldier. The investigation had identified the others, 3 more rangers, all targeted near this hospital, all intelligence operations by a foreign entity attempting to compromise military personnel. Ashley's deep cover had worked. Her presence had drawn the threat into the open where it could be identified and neutralized. The mission had succeeded even though her assignment had ended prematurely. Her son had asked the question that mattered, "Was it worth it, Mom? Losing your cover?" She'd touched the patch, the same way she did every morning. "I saved 17 soldiers in the Hindu Kush. I saved Torres here." Some covers, once blown, reveal foundations too strong to collapse. The words meant everything. They meant nothing. They meant that you don't count the cost when the alternative is watching people die. Across the city, in a studio apartment with linoleum flooring and a view of the parking lot, Dr. Marcus Mercer stood in a community college gymnasium at 6:22 p.m. on Tuesday evenings, teaching CPR to a bored rotation of students pursuing healthcare credentials. His medical degree hung on the wall beside a citation from the state board noting his probationary license status. His paycheck was $2,400 per month. Rent was $1,200. Legal fees for the federal review were $800 per month, ongoing. He'd lost his privileges at 4 hospitals. No medical institution would hire him. Minimum wage CPR instruction was all that remained. A student asked if he'd ever worked in a real hospital. He said yes, once. They asked why he left. He didn't answer because the answer was Ashley Cooper, because the answer was arrogance, because the answer was the moment he'd decided that a woman who saved lives was a threat to his authority. He'd been wrong about that. He'd been wrong about everything. 12 weeks after her termination, Ashley conducted grand rounds in the same conference room where Mercer had humiliated her, where he'd suggested before the entire surgical team that she'd nearly caused harm through nursing overreach, where his smile had been the smile of a man certain he was untouchable. She stood at the head of the table. The residents sat in rows, notebooks open. Rodriguez and Kim, the 2 residents she'd mentored before Mercer turned them against her, sat in the front row taking detailed notes. Ashley presented a case study on field medical techniques adapted for civilian emergency medicine. Needle decompression. For placement under pressure. The physiology of shock in combat versus trauma. The techniques that had saved Torres. the techniques she'd learned by staying alive in the Hindu Kush where mistakes meant body bags. The nursing director, Helen Vasquez, introduced a new policy: military-trained nurses would receive expanded scope privileges, their combat medical experience recognized as advanced certification. The hospital was being proactive. The military community had spent decades training medical personnel in extreme conditions. Dismissing that expertise because of a civilian hierarchy made no sense. Rodriguez raised her hand. "Dr. Ashley," she started, then corrected herself. "Captain." "I mean, we didn't know," Ashley cut her gently, "you know now. That's what matters." The final slide appeared on the screen behind her. Not a medical diagram. A photograph. 2 soldiers in the mountains, Hindu Kush in the background, snow on the peaks, both wearing the same unit patch Torres had given her. One of them was younger. The other was her, unrecognizable in combat gear, the woman in that image shaped by different wars and different rules. "Medicine isn't about titles or hierarchy," Ashley said, her voice carrying the weight of someone who'd seen the alternative, who'd watched men die because of bureaucracy, who'd learned that sometimes the only difference between life and death was someone willing to do the right thing instead of the approved thing. It's about the patient in front of you. Always the patient. Never the ego. Never the position. She met the eyes of every person in the room. Held the gaze long enough that no one could look away. Power is not a title. Power is the ability to help. The screen faded on her hand, demonstrating the 4 technique, the same technique Torres had recognized as combat medicine, the same hands that had started a line in a trauma bay and ultimately changed the trajectory of 2 careers, one ascending, one collapsing, both shaped by a single moment of truth. If you found this story compelling, please subscribe and hit that notification bell so you never miss when we upload new videos. These stories of quiet heroism deserve to be shared. What would you have done in Ashley's position? What would you have sacrificed to expose the truth? Drop your thoughts in the comments below. We read every single one.